This week, a behind-the-scenes look at Hennepin Healthcare's troubles, and Washington says 340B rebates are coming in 2027. Welcome to the August 7th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
The Star Tribune offered a new behind-the-scenes look at the financial struggles at Hennepin Healthcare today. The newspaper said recordings of private meetings by hospital and county leaders showed growing alarm by hospital management about financial losses dating back years. Much of it stemmed from unpaid care. The losses eventually grew into an annual deficit that required a $205 million state rescue in May, as well as 100 layoffs and service line changes. The Star Tribune said hospital managers and board members repeatedly suggested interventions, but that the Hennepin County Board stepped in and blocked efforts to address the financial crisis. The county eventually eliminated the hospital board as HCMC leadership prepared another turnaround plan in 2025, the Star Tribune said. Hennepin Healthcare also cycled through 4 chief executives in 18 months. One of those former executives told the paper that HCMC would need still more state aid if governance didn't change. The state rescue plan, signed by Governor Tim Walz in May, calls for restoration of a separate Hennepin Healthcare board, limits on intervention by elected county officials, and an outside task force to address Hennepin Healthcare's woes, possibly including ending county ownership.
Also this week, the top statewide candidates on next week's statewide primary election ballot were in southwestern Minnesota for the annual Farm Fest gathering near Redwood Falls. The event featured a candidate forum for gubernatorial and Senate races. The debates focused largely on agricultural policy, but touched on health care as well. It also marked the first time gubernatorial candidate Senator Amy Klobuchar has appeared alongside the 3 GOP candidates, Minnesota House Speaker Lisa Demuth, MyPillow founder Mike Lindell, and retired healthcare executive Kendall Qualls. Klobuchar promised to bring down health insurance premiums on the state level if federal subsidies are not reinstated. She also talked about her plan to add 10,000 more apprenticeships, which she said would help build the healthcare workforce in rural Minnesota. And while condemning the killing of 2 Americans by immigration and customs enforcement officers in Minneapolis early this year, she suggested a recent funding boost for immigration enforcement could be better spent.
So it's bigger than the FBI now. It's bigger than the Marines. I did not support that. I think that $70 billion extra dollars should go to you for your health care.
Demuth suggested revisiting state policies like paid family leave, which she credited with driving up the cost of health care. Qualls offered few concrete policy examples, but criticized past action and inaction by both political parties. Lindell advocated for a direct primary care plan, a model where patients pay a flat membership fee directly to their primary care physician.
It's amazing, especially for rural Minnesota and especially for the inner city, both of them, because people are going to get direct care from their physicians that they didn't have before because of the deductibles that they didn't want to go take.
Minnesotans will decide in Tuesday's primary which of the 3 Republican candidates will run against Klobuchar in November. In the Senate forum, DFLers Angie Craig and Peggy Flanagan both double down on their views on how best to fund healthcare in the U.S. While the pair agree on several healthcare points, their approaches to universal healthcare have become one of the clearest policy differences between the 2 Senate DFL candidates. Flanagan once again backed the single-payer Medicare for All plan, arguing the current system of private insurance is failing patients. Craig reiterated her support for what she called Medicare for All Who Want It, a public option approach to universal health care. Former sports broadcaster Michelle Tafoya, another Republican contender for the Senate seat, blamed the Affordable Care Act for making healthcare more expensive and called for increased transparency for healthcare organizations.
We need to get back to basics when it comes to healthcare, and that means more transparency. You need to know what you're paying before you even walk in there.
Tuesday's primary will determine which 2 candidates advance the November general election. The winner will replace retiring Senator Tina Smith.
And in federal healthcare news, the Department of Health and Human Services has released a revised model for a 340B drug program rebate pilot and made it effective next year. Ellen Florek has more.
Under the pilot, hospitals and health systems would be required to purchase prescription drugs at full price and get discounts in the form of a rebate. That would be instead of upfront discounts. This is the federal government's second attempt at piloting a rebate model. The first was sidelined by a judge after legal challenges, including strong opposition from hospital groups. This new rebate model is more likely to be legally binding and covers 25 drugs instead of 10. Worth noting is that none of the 25 drugs included in the pilot are the high-cost specialty oncology and immunology drugs that drive most 340B spending. Drug manufacturers have until mid-August to submit their pilot plans. Any approved models will take effect on January 1st and run for at least 1 year. Meanwhile, Senate Democrats are eyeing a federal public health coverage option and reforms to private health insurance. Senator Ron Wyden and 16 other Democrats are asking for feedback on dozens of potential policy changes released last week in an 86-page RFI. The proposals are aimed at lowering costs and expanding coverage and include reversals of Trump administration rulemaking and Medicaid cuts, along with restoration of enhanced ACA subsidies. The request for information also picked up a proposal from hospital groups that would require large health plans to pay providers promptly. These proposals are not near-term legislation, but likely agenda setting ahead of the midterms. Also in the Senate, the Budget Committee met this week for hearing on Medicaid. Throughout the hearing, Republicans repeatedly brought up provider taxes and state-directed payments, calling them money laundering. Minnesota's application for a new state-directed payment program is still awaiting federal regulatory action. This hearing prominently featured allegations of fraud in Minnesota, where CMS has frozen about $550 million in Medicaid funding this year. CMS last week also finalized a pay bump for hospitals. Medicare reimbursements for inpatient hospital care will rise 2.3% starting October 1st. However, this has not kept up with inflation. An important reversal from the proposed rule is that DSH and uncompensated care payments will increase $228 million, a reversal from the $564 million decrease CMS originally proposed. A new technology add-on payment for certain inpatient cases will also add to reimbursements. And one final federal development to watch going forward. Key healthcare provisions may once again face a funding cliff later this year. While both the House and Senate are weighing proposals to fund the federal government through December 11th, neither version further extends funding for telehealth and hospital at-home programs.
And that's it this week from Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Thanks for listening.